Hello, I'm Dr. John McDougall. I want to talk to you about one of the more sensitive issues when it comes to the McDougall diet. Now, you know, most people think of the McDougall diet as a vegan diet. It means it has no animal products in the diet. And as a result, what fairly sophisticated people focus on is this must be a diet that's deficient in vitamin B12. And I have to admit that that's one criticism that you can lodge against the McDougall diet, because it's all based on plants. And as a consequence, plants don't synthesize B12, this essential vitamins. Animal products, they don't synthesize B12 either, but they do contain B12 because the B12 that's made by bacteria, only bacteria make B12. That B12 is stored in the animal flesh, the eggs, the milk secretions, and as a result, you can get B12 that way by eating animal foods. So as soon as somebody says, you're not eating any animal foods, they go, well, you must be B12 deficient. Well, to tell you the truth, the body's very efficient at conserving B12, so it's hard to become B12 deficient. I mean, you have to be 20 to 30 years without good sources of B12 to even think about running out of your B12 levels. And if you do become low in B12, the consequences are usually minor: a little anemia, a little tingling, and other what we call paresthesias of the nervous system that are easily reversible when you catch it and add B12. Now, it can result in some severe neurologic problems if you let the B12 deficiency be prolonged, and we don't want to do that. So what I recommend for people is, if they're going to follow the McDougall diet or any other diet without obvious sources of B12, and of course you're thinking about animal flesh, mostly in this case, then what you do is you supplement your diet. This is one case where I recommend supplementation. What you do is you add a non-animal source of B12, which is a supplement that you buy in the store, preferably the hydroxy or methyl form of B12 and not the cyano form. And you take a pill once a day, once a week, maybe a couple times a month, and as a consequence, your B12 levels should be just fine. You can occasionally check it by doing a B12 test, and that will give you your B12 levels. So there's nothing you have to sacrifice by following a healthy diet. No doctor, no dietitian, nobody can criticize the McDougall diet for its protein, its calcium, its general vitamin and mineral content, but they can get me on the B12. And the way I deal with that is I ask you to add a supplement. Now, you may be sitting there asking, why would the McDougall diet be deficient in anything? Well, as I told you, bacteria make B12. And in our modern society where we wash everything, we sterilize everything, we may get too few natural bacteria in our diet. And maybe that's why B12 deficiency can occur very rarely when you follow a strict McDougall type or vegetarian type diet. So you should be set free as far as your dietary choices go. You should not be worried about something that's really should be a non-existent problem if you follow the recommendations carefully. And as I recommend, you follow a starch-based diet with fruits and vegetables. And if you're on the diet for more than 3 years, pregnant or nursing, you add a supplement of 5 micrograms of B12 a day. Thank you for listening. I'm Dr. John McDougall.